For years, vaping was presented as a safe alternative to tobacco, without smoke, without tar, apparently harmless. But science began to look more closely, and the studies tell another story. Today we are going to talk about what has actually been observed in people who vape, what substances enter the body, what damage they produce in the organs, and what the final consequences of this chemical addiction are. What do we really inhale when vaping? The aerosol from electronic cigarettes is not water vapor. Chemical studies have identified nicotine in most products, formaldehyde, acrylane, heavy metals, nickel, lead, chromium, ultrafine particles, flavorings that become toxic when heated. These substances do not stay in the mouth. They travel directly to the lungs and pass into the bloodstream. Effects on the lungs. Clinical research has shown chronic lung inflammation, reduced respiratory function, higher risk of bronchitis, damage to the pulmonary alveoli, cases of severe lung injury known as EVALI. At the cellular level, studies show oxidative stress, destruction of lung tissue, activation of inflammatory responses. In other words, the lung behaves as if it were under constant chemical attack. Effects on the heart and blood vessels. Vaping does not stay in the lungs. Nicotine and toxic compounds increase blood pressure, accelerate heart rate, harden the arteries, promote vascular inflammation. Some studies already observe early markers of cardiovascular disease in habitual vape users. Effects on the brain. Nicotine alters the dopaminergic system. This causes strong dependence, changes in motivation, anxiety, irritability, difficulty concentrating. In young brains, studies warn alteration of neuronal development, greater vulnerability to other addictions. It is not just a habit, it is a chemical modification of the brain. Systemic toxicity. Ultrafine particles and heavy metals enter the blood, reach the liver, affect the kidneys, generate systemic oxidative stress. An increase in general inflammatory markers has been observed, suggesting progressive damage in multiple organs. The entire body participates in the intoxication. Final consequences of addiction. Longitudinal studies indicate clear risks. Chronic nicotine dependence, greater probability of smoking conventional tobacco, progressive lung damage, accumulated cardiovascular risk, persistent systemic inflammation. The addiction does not stay in the vape device. It becomes a maintained biological condition. The body adapts to the toxin and pays the price. Conclusion. Current scientific evidence indicates it is chronic chemical exposure, with real effects on lungs, heart, brain, and blood, and the earlier it begins, the greater the mark it leaves on the organism. If you want more information about vaping, Behind the Disease there is more. On YouTube I explain in more detail. Subscribe and comment.